All right, our next speaker is Signe MEŽINSKA, Associate Professor and Senior Researcher at the University of Latvia, Institute of Clinical and Preventive Medicine and Faculty of Medicine. She holds a PhD in Social Health and Illness from Riga's Students University in Latvia, MA in Philosophy, and MSc in Bioethics. Her scientific interests include biomedical research ethics, ethics of biobanking, rational use of medicines, and ethics of patient-physician relationships. She has been awarded national research grants as well as been a part of internationally funded research projects, including ROSiE project. She's teaching medical ethics, bioethics, and sociology of health and illness for more than 20 years to undergraduates, graduates, and PhD students in medicine and biology. Signe is serving as Vice Chair of UNESCO International Bioethics Committee, BBMRI Eric LC expert, ethics expert for European Commission, as well as member of several local research ethics committees. Signe, please.
Thank you, Rose, and thank you for inviting us to this meeting. My task today is to point at some social issues in the context of open science, and I will start with the fact that open science is not free of charge. It might be a surprise for some, but it costs something to publish in open access, at least in part of cases. Or if you think about preparing good quality open data, it means you need people who will do that, you need money for that, etc. And therefore, one of the significant social challenges for the integration of open science into national research and innovation ecosystems is caused by economic disparities between countries. And I would like to emphasize that it's not only about EU countries, but there are disparities between EU countries, but it's much more broader. It's a global issue, because it would be problematic to speak about open science if we speak about closed environment. And I think Henrika showed it very, very well how it works. So, in a report developed by New Horizon project, which was based on analysis on the situation in widening countries, the authors concluded that there's a big disparity among the analyzed institutions and countries. And when we look at countries outside EU, the situation is even more imbalanced. And we hold several focus group interviews during the ROSiE project with researchers from low and middle income countries. And these focus groups showed that economic factors and lack of infrastructure are significant barriers to open data sharing and practicing open science in very different ways. On the other hand, open science may bring economic benefit to countries and societies, but the costs emerging in context of open science can be significant economic barrier. So not only these economic disparities, but also power relationships between different countries sometimes manifest in relations between researchers from different countries. And researchers from more economically developed countries may significantly benefit by doing research in developing countries, while research results might be not returned to societies and research communities in these countries. And in this context, I think that the language issue, which also was mentioned, is something we haven't solved. Open science is speaking in English mostly, and the question how to include different languages, especially if we think about, for example, qualitative research results. We didn't mention today yet qualitative research, but qualitative research is not written in numbers. Qualitative research is written in stories, and how to ensure the open access to these scientific results, that's a question we should solve. Maybe AI translation might help, but we should think about that. Then Henrika already mentioned the different types of inequalities among researchers and inside scientific communities, and I will only emphasize that we haven't solved also gender inequalities, ethnicity, age-related inequalities in the context of science, and it's visible also and has results in the context of open science. For example, if you think about early career researchers to compare with senior scientists, you might guess who has more access to, I don't know, funding, for example, to publish in open access, and it's still a problem. And I would also like to emphasize a question about gender issues, because we are mentioning them, but still there is lack of analysis why and how gender inequalities might impact practicing of open science, and vice versa, how open science might impact gender inequalities. So it's something we should aim at and discuss in more details. But what wasn't mentioned today yet, I guess, is a very interesting question about researchers working in industry, because I think it's worth a separate discussion how to apply academic freedom to those who are working in the industry. And the fact is that this group of researchers might experience inequalities because of having fewer opportunities to practice open science, because of restrictions put by industry sponsors, and they are usually operating under a more closed model of data management. So actually, we have a case collection in our training materials, in ROSiE training materials, and one of the cases is about situation where a paper is retracted because it was sponsored by the industry, and industry didn't allow to publish data in open access. And you can read the case, but the problem is that the researchers somehow were losers because they cannot practice open science, and the context is this industry context. So another issue which was discussed previously, but which is still very open, is this changing of culture, and which is, I think, the core part of implementation of open science. And unfortunately, to change culture is very, very hard task. And it means changing values, changing the ways how we think, and maybe it's very radical suggestion, but I think we have implemented research ethics in our curriculums very well now. We all are trained in research ethics, and we do it. But I would say that to change the culture, we have also integrate philosophy of science in our curriculums, because I think much more students they learn ethics of science, but they don't learn and study philosophy of science, and maybe it's worth to do it. And yeah, I will not go into details about assessment system, but of course it's the same issue about changing cultures. But I think that the previous speakers really showed the problems and the possible ways. But one more issue which is connected to broader society is society science literacy and open science. And open science, and particularly open access publications, are considered as a part of the solution for improving science literacy. But however, there still are difficulties, even in countries where the open science is implemented successfully. And those problems are, for example, the fact that publications are written by using very specific scientific terminology and might not be understood by the general public, as well as it is difficult to change existing publishing practices. So it means that we can say that public can access the scientific results in scientific publications, and indeed indeed, many of them are accessible just by I don't know, Googling, but the way how scientists speak with society still need improvements, and there are, of course, some good examples, like Cochrane creates very good abstracts for patients on scientific publications, and they also use citizen science approaches to that. But we should expand these very good practices to other fields of science and make science closer to society in very different ways. I think that's it.